For your health now, there are more than 1 million people in the U.S. living with blood cancer, and September is Blood Cancer Awareness Month.
Joining us now to talk more about this important topic is Frank Martinez and Dr. Fernando de Zaraga. Good morning, gentlemen.
Good morning.
Good morning. Well, Dr. de Zaraga, first of all, what is CLL and who is affected?
So September is in fact Blood Cancer Awareness Month, and so we're here on behalf of Genentech to help raise awareness for CLL. CLL is a slow-growing blood cancer. So it's essentially slow-growing cells in the blood and the bone marrow, which typically affects older people. The typical age is about 71 years of age. Typically affects more males than females, and people from North America and Europe relative to other parts of the world.
And Frank, you were actually diagnosed with CLL 7 years ago during a routine blood test. How did that change your lifestyle?
Well, I was diagnosed in 2007, and at that time I was working for a hospital as an X-ray technologist. And next to us was the hematology department, and they had bought a new equipment, and they asked me if I wanted to be a volunteer. So I did. And a few minutes later, they told me that the equipment was working fine, but my blood was abnormal. So I went to see Dr. de Zaraga, and he ran some tests on me, and unfortunately they all came out with CLL, positive for CLL. And I was advised to see him every 4 months, and until I got a severe leg infection, and he recommended to do treatment, and it was consistent on 6 cycles of Gazyva and chlorambucil chemotherapy.
Well, Frank, what is your advice for others who have been diagnosed with CLL?
I would advise, if you are diagnosed with CLL, to see a doctor right away, to find a good health care that could explain to you about the different resources and options for the patient.
And Dr. de Zaraga, what resources are available for people with blood cancers such as CLL, and where can people find them?
So resources are very important for patients. It's important to become educated and informed. So your first stop really should be your doctor or your healthcare practitioner. There's really no substitute for that. But beyond that, if you want to get more information, then there are several websites that people can turn to. The Leukemia Lymphoma Society is one of them, and the American Cancer Society also both have excellent websites that can provide a lot of information for patients.
Well, gentlemen, we can't thank you enough for being here this morning to talk about this important topic. We appreciate it.
Thank you.
Thank you very much.
Thank you. Thank you.